Welcome to Penrose Learning, where we make understanding easy.
You start by prepping efficiently. Cleanse the area thoroughly and pat dry because any oil prevents effective microneedling. Once done, attach a sterile cartridge. Choose 0, 25:1, 0 mm for home use, and select a low speed if it's your first time. Apply topical numbing only when necessary, wait 20 to 30 minutes, and then remove excess cream. Now hold the doctor. Pen at a 15-45-degree angle and make your first short pass with light pressure, moving with the skin's natural lines. Once you've completed the initial pass, divide the treatment area into small 1 to 2 centimeter zones to maintain control and even results. Move methodically. Perform 4 passes per section, vertical, horizontal, and 2 diagonals, so the needle channels are evenly distributed. Make sure you don't overwork areas that are already red or bleeding. Stop and let them calm. Also, sanitize your device between zones and swap the cartridge after a full face session, or if you notice decreased glide or irritation. To finish, gently apply a hydrating serum. Peptides or hyaluronic acid work well, because these molecules penetrate more effectively after microneedling. Once done, follow with sunscreen of at least SPF 30 anytime you go outside. Do not use retinoids or chemical exfoliants for 48 hours. Expect normal redness and possible light scabbing for 3 to 7 days. If you notice severe pain, spreading redness, pus, or prolonged bleeding, stop treatments immediately and consult a medical professional for evaluation.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.